The British Medical Association has continued its calls for more protective equipment, warning the lives of healthcare workers are being put at risk. More than two-thirds of doctors questioned by the union said they do not feel protected while treating patients. The poll of 2,000 medics also found that some feel forced to come into face-to-face contact with infected patients without the right equipment. Well, joining me now is the chair of the British Medical Association Council, Dr. Chaand Nagpaul. Thank you very much indeed for being with us. This obviously has been a cause of great concern that frontline health service workers should have the safety equipment they need. From your survey, what is the picture around the UK?
Now, remember, we did our survey over the weekend as a snapshot, and this was after the government last week had pledged repeatedly that millions of units of protective equipment had been delivered to the front line, and that there were no shortages, there weren't any issues. And we also last week were given very specific guidance by Public Health England that the government endorsed of what sort of protection healthcare workers should be wearing to prevent them becoming infected. Now, on both of those counts, this survey shows that we are nowhere near what the government is pledging. The reality on the ground is starkly different. We're seeing shortages across the piece in hospital and GP practices. Simple equipment such as having eye protection, because we know the infection can be transmitted through the eyes, is not available in 60% of GP practices completely. They've never had any supplies, and yet that is a recommendation from government. We're hearing of shortages even down to soap to wash your hands. And doctors who are in the most high-risk areas, such as intensive care units, where what we call aerosol-generating procedures occur, where there's fine particles of infection in this highly contagious area, well, only half of those doctors actually say that there are adequate supplies of that special sealed masks that they need. So this is actually, a really worrying picture. It also comes at a time when we're hearing of more doctors, sadly, and healthcare workers dying of coronavirus. There are 100 deaths in Italy, and those doctors have now come out to say that lack of protective equipment is contributing to the deaths of healthcare workers. So we're extremely worried, and this paints a picture quite apart from what the government is telling us.
Do you have any idea how many frontline doctors have now died from COVID-19?
So in the UK, we've now heard of 10 doctors who've died of COVID-19, and that's tragic. Remember that, and in addition, we've heard of increasing numbers of nurses. And remember that, we're talking about social distancing of 2 meters. Well, doctors are treating patients inches away. And if you're close to a patient who is highly infectious, the one thing that the government owes us is the equipment to prevent us becoming infected. And that equipment is well established. The government itself has described what that needs to be. So if you then find that you neither have the equipment nor the correct equipment, that seems inexcusable.
There is, of course, exceptional global demand for this equipment at the moment. Is there simply the supply capacity there to produce the amount of equipment that's needed?
So there is a global shortage. So what I did last week on behalf of the British Medical Association is I've called on government to repurpose the entire sort of capacity of manufacturing. Remember, if we can ask industry to build ventilators from scratch when they've never built ventilators before, it wouldn't require quite the same level of technological effort to mass produce simple things like protective masks, disposable aprons and gowns, and also eye protection. And in fact, we've heard of even some schools producing eye protection, plastic eye protection. So in our view, this needs to be an absolute priority to focus the entire manufacturing capacity and repurpose it to protect healthcare workers, doctors, nurses, and others.
Dr. Nagpaul of the BMA, thank you for joining us.